Hello and welcome once again to Pale Blue Thoughts. I had started a series in which I was going to explain the various imaging technologies that modern medical science uses to see inside our bodies. I had explained about X-ray imaging, fluoroscopy and mammography in my previous video. Today we will see another interesting and highly useful technology called Computed Tomography Scan or CT scan. It used to be called as Computed Axial Tomography Scan or CAT scan earlier. CT scans can produce highly detailed images that provide information about the size, shape and density of various organs, tissues and structures in the body. They are commonly used for diagnosing and monitoring conditions affecting the brain, chest, abdomen, pelvis and so on. They are also useful for seeing one's bones, soft tissues, blood vessels and areas of abnormal tissue growth such as tumors. In this video, I'll explain how CT scans work, simplify the science behind its workings, its benefits and the vital role they play in medical science. Hello, I am Anand and I welcome you all to yet another interesting episode by Pale Blue Thoughts, the channel that aims to promote scientific temper. So let us dissect the words first. Computed tomography. Let's understand what tomography is first. Tomo comes from the Greek words tomos, which means a slice or a section, and graphy, which means to write or describe. The device used in tomography is called a tomograph, while the image produced is a tomogram. Now look at the image on the left. It has four objects with different shapes. One is a cylinder, one is a cone, and in front of these are a sphere and a semicircular sphere. If you pass light from behind them and you see their projected image, you will see the images like on the right. Now if you slice the image at S1 and S2, you will get a cross section of the objects. The cone would appear as a triangle, the cylinder would appear like a rectangle, the sphere would appear as a circle, and there would also be a semicircle next to it. You are looking at the cross section of the image. Notice the difference between the first projected image and the cross section. You are seeing the same thing from different angles. This is what is used in tomography. You would see a cross section of a part of your body. Now when you pass an X-ray or any other form of radiation, you won't get an image like you got in an X-ray. The detector captures the radiation and sends it to a computer which decodes it. Hence the name computed. There are multiple types of tomography which uses various kinds of sources to get tomograms like visible light, laser scanning, electrical capacitance, X-rays, gamma rays, sonar, ultrasound and positron emission. I won't go into too much details there, so let's stick to CT first. Now let's see how the system works. A CT scan machine consists of a large donut-shaped machine called a gantry, which houses an X-ray tube and detectors. The patient lies on a table that moves into the center of the gantry. The X-ray tube inside the gantry emits a narrow beam of X-rays that pass through the body. The tube rotates around the patient, capturing multiple X-ray images from different angles. It is like a camera taking many pictures while moving around you. On the other side of the machine, there are detectors that measure how much of the X-rays pass through the body. These detectors collect the information. The X-rays go through your body and get absorbed or weakened by different tissues like bones, organs or muscles. This creates different shades of grey on the detectors. Now let's see how this system works within. As the X-rays pass through the patient, they are either absorbed or radiated differently by various tissues according to the tissue density. Consider the first possibility that a ray passes right through the body. If you remember the video on X-rays, this is called penetration. Now our body has different things like tissues, bones, fluids, etc. All such objects do not behave the same when radiation falls. Some pass through, but some gets absorbed. Suppose there is an artery, let's say A, in the path of the radiation. Suppose it absorbs 20% of the incoming X-ray. The rest 80% reaches the detector. Now let us say there is another object, say a bone, which we will call B, which absorbs only 10% and 90% penetrates to the detector. So different materials absorb and penetrate at different levels. Now the human body is composed of several such materials. Look at this picture which has on the first row two things which is made of material A and one is made of material B. On the second row it is one A between two B's. Third is two B's then an A. Since we know the absorption percentage of each object, we can compute what the final output would be when light reaches the detector. Now let's cast the radiation from different angles. Each time the detected radiation would be different. So unlike in the case of an X-ray imaging, we won't be getting a shadow of the object, but we will get a lot of data about the penetrated X-rays. As the rays pass through the body, they are weakened to various degrees depending on the tissues that they encounter. This weakening of radiation is converted to electrical signals. These are called Voxels. Now this is given to a computer. The computer uses that information to create detailed pictures of the inside of your body. It puts all the X-ray pictures together, sort of like making a puzzle to create cross-sectional images. We have designed several algorithms which uses mathematical models such as Fourier or radon transforms and can create a visual representation of the raw data called a sinogram. The computer then produces a cross-sectional image. Many such images can be stacked together to create an image that we can identify. On this image, on the left is a sinogram or a graphical representation of the data received, and on the right is an image sample derived from raw data. The sinogram would not be any use for a radiologist or a doctor, but the recreated image can give valuable information about the body to a trained radiologist or a doctor. These images show your organs, bones, blood vessels, and any problems like tumors or injuries. The reconstructed images are viewed and interpreted by a radiologist who analyzes the structures and identifies any abnormalities, and the report is given to a doctor for further analysis and decision making. Today's computers can create 3D models using the stacked images so that the medical practitioners can get to see a 3D view of the cross sections. They can rotate the images the way they want so that they can see the image from any angle that they want. Now let us come to the advantages of CT scans. CT scans provide highly detailed and cross-sectional images of the body, allowing healthcare professionals to visualize internal structures from different angles. This level of detail helps in the accurate diagnosis of various conditions, including tumors, fractures, infections, and other abnormalities. They are versatile and can provide valuable information about different organs, tissues, blood vessels, and bony structures. CT scans are relatively fast, and the entire procedure can be completed within a few minutes depending on the area being imaged. They are non-invasive, meaning they don't require any surgical incisions. This makes them preferable over invasive procedures like surgery, allowing for a quicker diagnosis and reducing patient discomfort. CT scans are invaluable in emergency situations as they can quickly provide information about internal injuries or bleeding. They can help guide immediate medical interventions and surgical procedures, improving patient outcomes. In some cases, a contrast agent is used to increase the contrast of structures or fluids within the body. Contrast agents are commonly used to improve the visibility of blood vessels and the gastrointestinal tract, enhancing the quality of an MRI scan. All this said and done, it is important to remember that CT scans use X-rays, which involve a small amount of ionizing radiation. Doctors use CT scans when they believe the benefits outweigh the risks, and they take precautions to keep the radiation exposure as low as possible. In general, higher radiation doses result in higher resolution images, while lower doses lead to increased image noise and unsharp images. Hence, an important issue within radiology today is how to reduce the radiation dose during CT examinations without compromising the image quality. Newer algorithms like iterative sparse asymptotic minimum variance have been developed, which provides great resolution images without requiring high radiation doses. Several studies have been done to analyze the effects of radiation on the issue of radiation-induced cancer. If the lifetime risk of developing cancer is 40%, then the absolute risk rises to 40.05% after a CT. The risks of CT scan radiation are especially important in patients undergoing recurrent CT scans within a short span of 1 to 5 years. So it is important to tell your doctor if you have had a CT scan recently. As the technology develops, we would be able to bring down the harmful effects further, because unlike alternate medicine systems, modern medicine is not unwilling to change. So to summarize, although there might be certain harmful effects of long-term exposure to ionizing radiation, CT scan still proved to be effective in understanding what goes inside the body. Ultimately, the power of CT scans lies in their ability to improve lives, provide answers, and guide medical interventions. They exemplify the incredible advancements that modern medicine has to offer. CT scans serve as an invaluable tool in healthcare, allowing doctors to visualize the inner workings of the human body with unprecedented detail and accuracy. And there you have it, an insightful journey into the world of CT scans. I hope this video has shed light on the importance and remarkable capabilities of this medical imaging technique. I hope you enjoyed this episode and found the information useful. If you haven't subscribed, then please do if you want to see more scientific videos. Please like, comment and share the video if you found it useful. You can also become a member of Pale Blue Thoughts by clicking on the join link. Your contributions are always welcome and appreciated. Links to contribute are in the description box below. I shall be back soon with another miracle of science. Until then, it's bye-bye from Pale Blue Thoughts.